Under a capitalist society like ours is here in America, everyone worships the almighty dollar. Part of the American narrative is to pursue the American dream. Go to school, get a good job, climb the ladder, have a family, build a big house. Profits are praised, high profits even more so. Well, what is the issue with constantly seeking higher and higher profits, you may ask? Well, it becomes an issue when human lives are at stake, when human lives are the bargaining chips, and when human lives are negatively impacted, which is generally what happens in for profit healthcare. The United States healthcare system has really been brought to the forefront. We're seeing some renewed light on this issue in light of the recent unaliving of the United Healthcare CEO, Brian Thompson. We have seen stories come out in droves of people whose lives or the life of loved one was negatively impacted after a health insurance company denied their claim and ultimately denied them treatment, oftentimes life-saving treatment. We are also aware that even in instances where claims are not denied, we often see these situations where copays, deductibles are so insanely high that people still have no choice but to forego necessary medical attention. Not to mention that some are unable to afford insurance at all in the first place, whether it be for lack of employment or lack of full time status with their employment or just poor benefits offered by employers. And really, the list goes on and on. These are all symptoms of a sick and predatory system. Out of wealthy countries, the United States ranks last in healthcare outcomes. We have the highest rate of maternity mortality and infant mortality. We rank last in healthcare access and in healthcare equity. And this is despite having the largest government spending in healthcare per capita among wealthy nations. Prescription drugs are also more expensive here in the United States, nearly double what it would cost if you lived in France or in Britain. So, why is this the case? Well, the short answer is corporate greed. In the case of our prescription medications, a lot of pharmaceutical companies see the United States citizens as a payday solely because of the pure dysfunction of our current healthcare system. We have no price controls in place to prevent this expensive pricing, this price gouging. And we do not have a solitary, consolidated, single negotiating body to intercede, which has resulted in negotiations with pharmaceutical companies being split among thousands of different healthcare plans. Here in the United States, we have seen the emergence of these huge medical industrial complexes. Insurance companies all seem to be united under the common goal of turning major profits and lining the pockets of their shareholders, investors, and CEOs, all while turning away from patient-centered or patient-focused care. You see, when healthcare is made to be for profit, when it's seen as a system through which people can gain wealth, humans are not seen as living beings that are worthy of dignity or respect or even care. Because healthcare is for profit, you are seen as a number on a spreadsheet. You are seen as pennies and dollar signs. It is more profitable to sign you up for a lifetime of treatment for chronic illness than it is to provide you with a cure. A for-profit healthcare system is not working in your best interest. In a for-profit healthcare system, their foremost goal is keeping costs low while keeping profits as insanely high as possible. There are many ways that these huge medical industrial complexes strive to keep profits high by keeping costs low. One way is by cutting staff in hospitals and in other healthcare facilities, or decreasing the amount of staff that is available to see patients during the workday. Simply by cutting staff, there are less salaries being paid out, and there are less benefits being paid out to those full-time employees, which therefore increases profit margins. The result usually is that you will have one staff member doing the work of 2 or 3 people, which I can tell you as a licensed practical nurse leads to burnout. It leads to stress, and it ultimately leads to a lower level of patient care being provided. Corners get cut and things get missed. Another tactic that these corporations will put into place is to reduce the amount of time that your medical healthcare professionals can spend with each patient. We'll label this as being efficient or time conscious, when actually what happens is that your loved ones are being seen in a rush. Things are getting brushed up under the rug or not even addressed, all for the sake of saving time, all for the sake of being able to cram more patients in. Another thing, when healthcare is for profit, areas that are already underserved when it comes to healthcare professionals are getting neglected even further. These underserved communities continue to be overlooked because when you are seeking profit, when you are profit motivated, your main goal is going to be to attract clients that you know can pay your fees, your often overpriced fees. So healthcare tends to be focused around wealthier areas instead of where the need is greatest. And if you are providing healthcare with the first and foremost goal being profit, you will overcharge and you will overtreat. There will be a plethora of unnecessary tests and treatments that are done that are literally being performed for the sake of billable activities, billable hours. Those who most need your health care will not be able to access it because they cannot pay, while those who are able to pay are going to be overtreated and overcharged. Because, like I said, it is easier to manage a chronic illness when you're coming from a perspective of profit to manage it for a lifetime versus giving a cure. Now, many of us ask ourselves over and over again, what are we doing wrong? Like, what are we doing wrong here in the United States? Why are other countries doing a better job than we are of providing health care to their citizens and having better outcomes? This is definitely a multifaceted question. However, I think it would be completely remiss to ignore the role that corporate greed has played in this and continues to play in the devastation of our peoples and of our healthcare system. The number one cause of bankruptcy in the United States as of today is medical debt. There is no reason that anyone in the wealthiest country in the world, the greatest country ever, should go broke paying for necessary medical treatment. Medical care should never bankrupt anyone, especially, and hear me when I say this, especially not when corporations are lining the pockets of their shareholders, investors, and CEOs. And I mean, when they are turning billions and billions of dollars worth of profit every year. We can do better.